Hi, I'm Jill Morell. I'm Head of Public Engagement at CQC, and we're going to be talking today about the people and communities theme of our new strategy.
Hi, I'm Dave James. I'm Head of Adult Social Care Policy at CQC, and I'm going to start off by taking you through the main themes of our strategy. CQC's purpose is more vital now than ever. And over the next few years, we're changing how we regulate to improve care for everyone. The COVID pandemic has renewed the focus on inequalities in health and in social care, and we need to be more flexible to be able to respond and to manage risk and uncertainty. We feel it's now not enough just to look at how one service or one provider operates in isolation. We need to look across health and social care and how systems work to deliver high quality services for people. Our strategy is built on 4 main themes, and those 4 themes interlink. And throughout each of those themes, we want to improve people's care by looking at how well systems come together and how inequalities are tackled and addressed. We'll implement our new strategy over the next 5 years, and we'll be continuing to be flexible and adapt to changes that we see in health and social care. The 4 themes to our strategy are a focus on people and communities, being smarter in our regulatory approach, making more use of information in driving our activities, embedding safety through learning and learning cultures, safety cultures, and accelerating improvement in health and social care.
So the first and fundamental theme of our new strategy is people and communities. This is all about focusing on what matters to the public and to local communities when they access, use and move between services. There are 3 themes in this theme of the strategy, and that is listening and acting on people's experiences, empowering people and prioritising people and communities. I'm just going to talk about the first 2 of those, listening and acting, and people are empowered. We want to transform how we encourage and enable people to share their experiences of care with us in a way that works for them. It means transforming how we capture, use and analyse people's feedback, building trust with the public and motivating people to share their experiences with us by showing how we've acted on what they've told us. So we'll enable people to give feedback in different ways that work for them. We'll develop the skills and tools that we need to enable all people to share their experiences. And a priority will be improving our capacity and capability to get the most out of that feedback by changing the way we record and analyse it, so it's easier for us to quickly identify changes in the quality of care, both good and bad. Building systems that enable us to track and prioritise people's experiences throughout our regulatory processes, and being clear, most of all, about the value and weight we give to quantitative and qualitative intelligence when we use it with other forms of evidence. So when people take the time to share their experiences with us, we'll provide a response that clearly explains how we've acted on what they tell us and how it's informed our view of how a service is performing. And we know that people are often afraid to speak up, so we want to help build a new understanding among the public, health and care providers and our partners that welcomes, values and acts on the feedback to improve care for all. Just moving on to people are empowered, the second of the themes of this section of the strategy. We want to help empower people to drive change, and it's important for them to know who we are and understand what we do. So we'll more proactively raise public awareness of CQC, be clear about our role. We'll invest in the most effective ways to do this. And we want to put people at the centre of all the conversations we have about the quality of care. We want an agreed and shared view of quality that will enable a joined up approach that's applied to services, corporate providers and across system boundaries. It will empower people to have more control in their care and encourage services to improve. We'll be clear about what standards people can expect from services, and a really clear definition of what good and outstanding looks like based on what people say matters to them. And we'll use that as a basis for assessing services and the information that we collect as evidence. Also, very important, we'll encourage people to use our information in ways that are relevant to their lives, with an up-to-date view of the quality of care in a service that helps people and families make informed decisions when they're choosing where to go for their care. That means they'll be confident in the knowledge that our information reflects the quality of care they can expect on the day they receive it. I'll hand over to Dave to talk about the third bit of this section, which is prioritising people and communities.
Thanks, Jill. We know that care is better when it's co-produced with the people that use those services, and that it's delivered in a true sense of partnership with them. And the same is true of regulation, and we want to make sure that we evolve our regulation in line with people's expectations in a co-produced way. We'll work closely with people that use services and people that represent them to understand their needs and to co-design and co-produce to continue to develop how we work and the services that we provide to the public. And any changes will start from a clear understanding of what people expect and what they need from care services and from care pathways, and from us as the regulator. We want to involve people in a meaningful way, and we'll encourage and support people to do that in the way that works best for them. It's not just about regulation though. Local health and care services and commissioners also need to understand the diverse needs of their populations, and they need to come together to work as a coherent system in order to meet these needs and improve people's health and well-being. So we'll be focusing on how local areas are working together with other parts of their community to enable better outcomes and tackle inequalities. As part of our assessment of providers, we'll look at how they work with their partners in the system and with other players in their community to drive improvement. And we'll look at how effectively they involve people in designing and improving services. So as well as assessing individual services, we'll look across whole systems. It won't be acceptable for services not to be looking outwards in this way and to be working in partnership across their local systems. We'll look at how well systems perform against the things that matter to people and to communities, and how outcomes are affected by that work. We want to be able to identify and call out any unwarranted variation and inequalities in health and care and in access to health and care. We know that people's health and well-being is significantly affected by factors outside of health and care services. So we will support those local systems to understand the needs of their local populations, especially those that face the most barriers to accessing good care or those with the poorest outcomes. So to summarise, there are three core ambitions here around our role in health and care systems. We believe it's more important than ever for health and care services to work together as a system and to meet the needs of individuals and their local population. It's not enough for us and for others to just look at how one service operates in isolation. It's how services work together that has the real impact on people's experiences. And thirdly, we're adapting to this, and our assessments of care will look at every stage of people's journey as they move through the system from their perspective in terms of what they expect and what their rights are, looking at both individual services and across pathways across different providers and organisations. We'll continue to have a focus and strengthen our focus on reducing inequalities. We want everybody to have access to safer and better quality care, and we'll champion this in everything that we do. We want to understand why there's such variation across the country in how people get the care they need, and so we can help to tackle it. The COVID pandemic has highlighted the inequalities that remain across different areas of the country and for different groups of people. We will use the learning from this experience to drive change and improvement.
Finally, we've developed this strategy in partnership with people and providers and others, but we really want to hear what you think of our thoughts and proposals. The quickest and easiest way to respond is through our online form at cqc.org.uk/strategy2021. Thank you.